Assalamu alaikum. I am Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine, Bashundhara Ad-din Medical College. Today, I am going to discuss on the topic doctor-patient relationship. That is a very vital point in case of the clinicians to dealing in patients. The doctor-patient relationship is based on certain facts that are shared beliefs, compassion, being present in all aspects, mutual respect between the doctor and the patient, knowledge and experience of the doctor regarding the patient's issue and condition, confidentiality, personal chemistry between the practitioner and also the patient, honesty and integrity, trust and confidentiality, opportunity to learn, and finally affordability. There are certain manners and aspects regarding the building this relationship. First of all is bedside manner. When a patient comes to a doctor in regarding a health issue or something, the patient feels fear, anxiety, sometimes self-pity when entering into the examination room. It is always been the doctor's responsibility to calm the fear of the patient as well as provide hope, installation on certain regarding the issues in future. The bedside manner of doctor that is human, compassionate, empathetic and supportive. Three core principles are maintained in case of professionalism, that are competency, primacy of the patient welfare and social justice. Now, the concept of doctor-patient relationship, in short term DPR. It is regarded as a special kind of social relationship where the bonding is planned and carried out with the final objective of helping the patient to achieve their treatment goal. It is a positive therapeutic relationship that encourages active participation of the patient in the treatment plan, contributing to success of the treatment goals and minimizing malpractice suits. It is a therapeutic, multi-layered, dynamic and bilateral relationship that reflects the wisdom and understanding that is distilled from generation to generation of doctor. It demands respect, displays compassion and sets the scene of trust. An integrated human activity prioritizes both human values as well as the morality. Since Hippocratic days, patient has been asked to trust their physicians without questioning them. But recently, doctors been asked to trust their patients by conversing with them about medical options, soliciting their views on how to proceed. Some aspects of DPR are followings, that are informed consent from the patient regarding their health issues and further procedure, sharing decision and making the decision. That informed consent of patient also improvises the opportunity to choose among the treatment options provided by the physician. Physician's superiority is must regarding taking decision as well as also helping of the patient. Physician's biasness is also required as the physician overestimates their communication sometimes, benefiting or pleasing in both sides. Transitional care that includes integrated care as well as the multi-professional care. Turn taking and conversational dominance. Presence of other person that is mandatory in case of certain sensitive examinations such as sexual issues, taking psychological interviews or even maintaining the confidentiality is always influenced by the presence of another. Bedside manner is maintained always by vocal tones, body languages, openness and concealment of attitude that may affect bedside manners. Expectation for reassurance, free to ask question, information of lab results are to be participated in decision making. Patient behavior is also a vital role as rudeness or aggressive behavior of the patient as well as the family regards in aspect. Fundamentals of a dynamic doctor-patient relationship regards are communication. A good communication skills are essential to establish an effective and dynamic doctor-patient relationship. This effective communication can result in multiple impacts on various aspects of health consequences in future. Doctor's empathy is important are vital to ensure the quality of this relationship. This improves the therapeutic effect and the patient's quality of life. Trust is the most important thing in both aspects. Doctors allow the patient to effectively discuss their health issues, enable them to comply with the doctor's guidance that results in improvement of their health. Informed consent that always must be taken from the patient, as well as it may be documented, called informed written consent. Maintain professional boundaries, and finally, patients need to avoid frequent phone calls and unscheduled visits to their doctors for health. Now, the point is elements that is built for doctor-patient relationship. First of all is trust and confidence, that is must in case of this building relationship. Installation of hope and minimizing the fear of the patient regarding their further venture. Dignity, respect and empathy. A personal relationship based on context of disease, illness or even the treatment. Confidentiality is must in these services, as the doctor is assured to keep the secrecy of the patient's condition that are not revealed in open others, as well as the trust between the doctor and patient, as patient is trusted to the doctor. Informed consent, as mentioned before. Then the patient's autonomy regarding taking decision, making decision and choosing the options. Truth telling. The patient always must tell the truth about their health issues and other facts to the doctor in regarding the further venture. Conflict of interest, fairness and equity must be present. The bridging cultural gap is must. Communication, that is an excellent, good, well behaved, and finally specific health issues, not as a whole in general. Now, to develop an effective doctor-patient relationship, some certain skills are mandatory, such as interpersonal skills, as how a doctor should ask the patient about the conditions or facts and what are the effects of their relationship. A communication skill is must, as both do be free and have the trust in each other. Where do they think they are ill or not? The doctor and patient both must have empathy regarding their issues in their relationships and regarding thinking that why is the patient ill, what are the consequences and what are the facts. Then inquiring mind, thinking why are these occurring. It is the illness part or of the pattern. Then the confidence, both doctor feel confident treating the patient as well as the patient feeling confident receiving the treatment service. Responsibility, both each other have responsibility regarding doctor to treat the patient as well as the patient entrusted to the doctor. And finally, interpersonal relationships, as mentioned before, the skills develops regarding the facts. Self-development is must in case of a professional skill. Interpersonal relationship is both in both aspects. Now, the communication skill, it is componental, type and also barrier. Expressive skill, listening skill as well as skill of overall management of the communications as well as the conflicts. Mutual understanding and cooperation between each other. The patient psychology is to be think must. And finally, ethical and legal expertise. Patient has certain rights regarding receiving the medical services as the choice. The patient has his choice to select the doctor frequently and freely. Access to the healthcare facilities regardless of age, sex, religion, social status, emergency services to record and demand summary of the medical record. Dignity. The patient has the dignity to be treated with care, compassion, respect and also without any discrimination. Privacy and confidentiality is must, that is termed professional secrecy. Get information from the doctor and the medical centers regarding the investigation, diagnosis, treatment plan, alternative treatment plan, risk regarding the situation, complications and finally prognosis of the fact. The patient has right to to no refuse, also making decisions regarding the medical facts. He or she has the right to have the record of their medical plans, continuity of the treatment, comfort regarding the whole aspect, and finally compensation if there is any further complications. The starting point of doctor-patient relationship is created where there is an offer to treat or care in therapeutic intent, which form the key issue that is instrumental in establishing doctor-patient relationship. There is also an ending of this relationship as the situation may develop when breakdown of trust and respect between both and physician practice become too large to manage for the patient. Situations where it is appropriate for doctor to end the doctor-patient relationship are prohibited by legislation, prohibited by human right code, outlined as professional misconduct. Patients choose not to follow the specific doctor's instructions, and patient require urgent service that are not available here. Now, certain models are developed under which the doctor-patient relationship is established. According to this, one is a paternalistic model where the doctor is professional, nose-based, benevolent, gives order, and patient has to obey all. Another model is contractual model where the doctor and patient are contract for each other's mutual benefit. Patient agrees to the doctor's decisions. This model doesn't allow to trust relationship. Another is fiduciary model where the patient confidently entrusts his health care to doctor who takes on obligation of working for the benefit of the patient without necessarily sacrificing his own legitimate obligations. This fiduciary related to a holding of something in trust for other. Now, in building this relationship, someone has to be careful on conflict of interests as interest of patient versus society, interest of patient versus other patient, and problem of confidentiality. Another point is patient's belief and expectation. It is influenced by the previous experiences from the doctor or any medical service or medical center, literature, the media, family and friends, cultural influences, social significance. These beliefs influences the outcome. Third is doctor's consulting style. A doctor-centered style or patient-centered style is regarded. Length of consultation as average 8 minutes is more than enough for a patient-centered consultation styles. It is more difficult in further maintaining. Patient's influences on consultation depends on social and educational levels. Regarding these issues, the concept is based on frequent and having the conversations between the doctor and patient. Regarding this, the concepts are nowadays very much important in building this relationship, rather to have a healthy, dynamic and effective relationship in further outcome of the patient's health. That's all for today. Thank you. Assalamu alaikum.